Welcome back to MedMind.
Which layer of the uterine wall is the thickest? It's C. Myometrium. What is the primary function of the uterus? To nourish the fetus. What is the primary ligament that supports the uterus? A. Broad ligament. What is the approximate length of the uterus? Correct answer is C. 6 to 8 centimeter. Which part of uterus is continuous with the uterine body? Correct answer is B. Cervix. What shape does the uterus resemble? It's C. Pear. Which pouch lies between the uterus and rectum? Correct answer is B. Douglas pouch. What is the lower narrow part of the uterus called? It's C. Cervix. Which structure connects the body of the uterus to the cervix? It's A. Isthmus. What is the upper broad part of the uterus known as? Correct answer A. Fundus. What is the lower part of the cervix that projects into the vaginal cavity called? Correct answer is D. Where does the uterine cavity communicate with the uterine tubes? It's A. Base. What cells cover the mucosal layer of the uterus? It's D. Simple prismatic cells. What is the mass of a typical uterus? It's between 50 to 70 grams. Which surface of the uterus faces the bladder? B. Anterior surface. Where is the uterus located in the female body? It's B. Above the bladder. Which structure is situated between the anterior surface of the uterus and the bladder? Correct answer is D. Vesicouterine pouch. What is the upper part of the broad ligament that supports the uterine tube called? It's B. Mesosalpinx. What is the term for the forward tilt of the uterus when the bladder is empty? Correct answer is B. Anteversion. What is the angle formed by the body and the neck of the uterus called? It's D. All of the above. What change in the uterus position occurs when the bladder is full? Correct answer is C. Straightened. What does retroversio uteri refers to? Correct answer is A. Retroflexion. What is the outermost layer of the uterus? It's B. Perimetrium. What happens to the smooth muscle cells of the uterus during pregnancy? Correct answer is B. Enlarge. How long does the postpartum uterine involution process take? Between 6 to 8 weeks. What is the capacity of the uterine cavity? The correct answer is B. Which type of cells line the endometrium? It's A. Cuboidal cells. In which phase does the endometrial layer shed? Correct answer is A. Secretory phase. What hormone influences follicle growth during the ovarian cycle? It's B. FSH. During which phase of the menstrual cycle does the endometrial lining regenerate? Correct answer is A. Proliferative phase. What is the primary hormone involved in the secretory phase? It's B. Progesterone. What typically causes the endometrial lining to shed? Correct answer is decrease of progesterone. What phase of the menstrual cycle follows ovulation? Correct answer is A. Luteal phase. How long is a typical menstrual cycle? It's A. 28 days. Where does the embryo implant after fertilization? Correct answer is B. Uterus wall. Which artery primarily supplies blood to the uterus? It's C. Ovarian artery. Where does venous blood from the uterus primarily drain? It's B. Uterine vein. Where does the lymph from the uterine body drain to? Correct answer is B. Internal iliac nodes. What is the purpose of the round ligament of the uterus? It anchors the uterus. Which ligament connects the uterus to the lateral pelvic walls?
Comment your answer.